first thing is recognizing the symptoms of hypothyroidism in children. It's complicated. It's complicated because, and doctors aren't even recognizing it, because proper thyroid hormone affects every single cell of our body, right? Eyes, bones, muscle, skin, gut, brain, right? All of these cells are literally turned on by thyroid hormone. And therefore, when thyroid hormone is not optimal, they're going to be affected, and everyone's affected differently, right? Some people will have skin issues, some people will have gut issues, and some kids, right? I've got, plenty of kids who they may be growing well, but they've got gut issues, or they may have gut issues and they're not growing well. And so it's complicated to assess the proper level of symptoms in a child with hypothyroidism. But that's what I've studied, and I think it's important for doctors to not ignore these symptoms of hypothyroidism in children. So that's the first step, is recognizing it and doing thorough labs.
Hey there, it's Mike Meltzer with High Intensity Health. Thank you so much for tuning in. I'm grateful that you're with us today. We're with Dr. Erica Peirson, and we're going to give you strategies and tips about how to manage and help children with Down syndrome and prevent Down syndrome if you are expecting a child. She's going to share with us her journey, and this is what she focuses on in her clinical practice, and she speaks all throughout the world and coaches different doctors and parents on how to manage these different conditions in children. So Dr. Peirson, thanks for being here.
Yeah, thanks for having me, Mike.
I'm excited. So we met through a mutual friend, Ben Lynch, and we had coffee in Portland. This must have been like 2.5 years ago. And you've really blown up since that time and are booked out. We had to book this meeting, I think, in end of December, and here we are in March filming this. So talk about your journey and kind of what got you involved in helping children with Downs.
Yeah, what really got me started was the birth of my own son. Right. I was a few years into my medical practice. Sorry, I'll start over. My son was born actually when I very first started my medical practice, and started researching what was it about this extra chromosome, what genes were there, what proteins were being overexpressed. That's really where I started with how I could help my son, because I wasn't getting the answers I needed from the conventional Down syndrome clinics even. And so I started researching, and then was helping him. And then a few years into my practice, decided to help other children, and it's just grown from there.
Mm-hmm. Fantastic. So I guess what would you like to tackle first? You mentioned the genetic overexpression, and I think, a lot of folks tend to think that this is just a genetic mediated disease or condition, but is there environmental inputs that create this genetic overexpression on chromosome 21? You want to kind of tackle the issues surrounding that?
Yeah, that's a tough question, but a great one for sure. So what causes this extra chromosome, right? It really happens at conception, right? When the egg and the sperm come together and the cell starts to divide, right? That division, that initial division, doesn't always happen properly. That mitosis, and so yeah, I've studied that for sure. What instigates that improper division of those chromosomes? And there is evidence that MTHFR and improper processing of folate and the methylation cycle can predispose a mother to having a child with Down syndrome. In addition to that, hypothyroidism in the mother can create an increased risk for having a child with Down syndrome. Subclinical or overt hypothyroidism, but a lot of subclinical hypothyroidism, as we know, is being undiagnosed, and so that can predispose somebody to having a child with Down syndrome.
Mm-hmm. Now, you mentioned too, offline, we were kind of talking about this, but the children born also have thyroid issues themselves, and where does that play into the picture?
It's a big part of the picture for sure. If you line up the symptoms of Down syndrome and the symptoms of hypothyroidism in infancy, they match almost exactly, right down to low muscle tone, delayed growth, delayed development, the protruding tongue, the shorter stature, delayed growth. Many of the conditions, the gut issues that kids with Down syndrome often struggle with, are all rooted in their hypothyroidism. And if we can intervene as early as possible to reverse that and optimize their thyroid function, it can make a huge difference. I've got some stories if you want them, but it can make a huge difference in these kids.
Yeah. Let's talk about that, but maybe, kind of go through the preconception planning and then talk about the children. So for parents to be, what advice or tips would you offer for them in terms of optimizing their endocrinology and then looking at MTHFR and some of these things? Like what are practices on the preventative side that you would like folks to understand?
Yeah, definitely having an understanding, preconception, especially if there's a family history or a personal history of genetic issues in children or miscarriage, infertility, etc., to work with the proper physician who's willing to look at in depth endocrine function, adrenal function, thyroid function in a mother, progesterone levels, right? Those are all connected and all absolutely related to to miscarriage and birth defects. And so, yeah, it definitely starts with the mother preconception, as well as nutrient levels, right? And when we're talking about nutrient levels and addressing any deficiencies, iron being worldwide one of the number one deficiencies worldwide. And so if there's an iron deficiency, there's going to be thyroid dysfunction for sure. And so looking at nutrient deficiencies as well as endocrine function, and of course, nutrient deficiency, we're talking about proper levels of folate, right? Methylfolate.
And then moreover, I mean, I guess we could talk, this is kind of obvious, but just to reinforce, stressors, we know that cortisol and so forth can cause reverse T3, which can create thyroid issues. So what sort of best practices do you have for mothers and fathers for that matter in terms of stress reduction and then also kind of detoxifying? Like we're all exposed to these persistent organic pollutants, but what do you recommend, like saunas or nutrients? Like let's tackle stressors and detox.
Yeah, I definitely like to start with diet for sure. Focusing on organic as much as possible, whole foods, making your own meals as much as possible. I've had recipes posted online how to make that. I mean, look, I'm a busy working mom myself, and so I've got some really fast, easy recipes that are whole foods, as close to the earth and the sun as possible. Is how I like to eat, as close to grass as possible. So definitely avoiding processed foods and organics, avoiding pesticides, using clean products in the home. Right, I'll tell you a little personal tidbit. I just washed my hair this morning with baking soda and vinegar. Nice. Right, I use clean products in my home, right down to my shampoo, our toothpaste, and then to remove any toxins from the environment, methylation, right, liver support, right. If there are pollutants that your body's exposed to and hanging on to, the way we clear those is through the bowel, liver, etc.
You have me curious now on the shampoo. So, tell us the details of that. How do we make that at home?
Yeah, totally. There's a huge movement. It's nothing complicated, really. I just put maybe a few tablespoons of baking soda into one of those squeezed bottles, like a ketchup bottle, and then another bottle. I have about a 50-50 mix of vinegar and water, and that's how I wash my hair. Yeah, baking soda first, and then the vinegar rinse.
Now, does it get kind of soapy, or it's like kind of watery?
Okay. No, not at all. Yeah, it's really interesting. Yeah, it's called the no poo movement. So people kind of moving away from that daily use of shampoo that's often full of sodium lauryl sulfate and who knows what else. Lots of chemicals right there on our head.
Right. I think I get the Bonners. I can't remember the name. It's got the, it's on all the PCCs and the co-ops and stuff like that. But I use it like maybe 2 days a week. We don't wash our hair every day with that sort of stuff. But yeah, the amount of crap that's in these cosmetics and just, cleaning products is insane.
Yeah, pick up a bottle of lotion, the cheap stuff at a pharmacy. I'm not going to name brands, but put that on your skin. That's like putting it in your body. Would you take that lotion and eat it?
Right.
So put coconut oil on your food and put it on your skin and you're good to go.
So Dr. Peirson, I travel a lot, and all these hotels now are going green and so forth. Like they're encouraging you not to, if you're there for multiple days, to reuse your towels and stuff. And then they oftentimes have these like green, they say, natural like shampoos and stuff. And I always bring my own shampoo when I travel. I think that's a nice tip, and maybe I could start with the vinegar and baking soda. But it's really funny, these shampoos in these hotels, like a Westin or Sheraton or whatever extended stay. It's marketed like it's eco-friendly and environmentally friendly and healthy for you. And you look at the back and it's just loaded with, like you said, sodium lauryl sulfates, but all these perfumes and parabens and who knows what else. So it's you have to really be smart and cognizant with what you're buying, even though it's packaged and presented like it's really healthy.
Yeah, consumers really have to educate themselves these days, unfortunately, because anyone can put a label. Labels on the front of food and these products are not regulated, right? Anyone can say all natural, right? There are certain labels that are regulated. I believe organic, GMO-free, those are fairly regulated. But things like green, all natural, those are not regulated. Anyone can put that on their product.
Mm-hmm. Yeah. Along those lines, and I don't mean to divert away from the discussion, but I was in a layover on an airplane, Southwest airplane, and I was sitting next to a woman actually who owns a fitness studio in Seattle. And in between us was this gentleman who was eating this bag of gluten-free like popcorn. And he's like kind of, I think he had a couple of drinks. He was talking a little bit loud and he said, I wonder if these are good for me. And the woman who ascribed herself to being a fitness person looked at it and said, sure, they're good for you. It says lean on the front, see? And they both laughed, said, yeah, huh? And they both ate it and laughed. And it's like, oh my gosh, that's kind of the mindset. So anyway, ignore the marketing. And so let's kind of talk about elevated levels of reverse T3 in children with Down. So what can practitioners or what should parents know about that and what can they do there?
Right. So the first thing is recognizing the symptoms. The first thing is recognizing the symptoms of hypothyroidism in children. It's complicated. It's complicated because, and doctors aren't even recognizing it, because proper thyroid hormone affects every single cell of our body, right? Eyes, bones, muscle, skin, gut, brain. Right, all of these cells are literally turned on by thyroid hormone, and therefore, when thyroid hormone is not optimal, they're going to be affected, and everyone's affected differently, right? Some people will have skin issues, some people will have gut issues, and some kids, right? I've got, plenty of kids who they may be growing well, but they've got gut issues, or they may have gut issues and they're not growing well, and so it's complicated to assess the proper level of symptoms in a child with hypothyroidism. But that's what I've studied, and I think it's important for doctors to not ignore these symptoms of hypothyroidism in children. So that's the first step, is recognizing it and doing thorough labs, right? We stress this so much, the other practitioners and the board members that I work with, the thorough labs, not just a TSH, right? Assessing a child or anybody's thyroid function with a TSH only is dangerous. It's dangerous, right? And I use that word carefully and very purposefully because we're talking about birth defects. We're talking about miscarriages. We're talking about the health and the future of children, right? And so when you assess thyroid function in anyone with a TSH only, you're missing a huge part of the picture because it's a multi-step process. And so we need to look at free T4 to assess the function of the actual thyroid itself. We need to look at free T3 hormone. That's the bioavailable hormone that's in the blood, and then reverse T3 to see if that's elevated, because if it is, then that's blocking the active thyroid hormone from being used, and it's a sign that there's a problem and it needs to be addressed. So thorough labs, and then antibodies, thyroid antibodies too.
So would you do these expanded panels in children? I mean, do you wait until you see symptoms, or do you just preemptively kind of do this because we know that the thyroid, as you mentioned, thyroid hormones participate in so much neurodevelopment and, physical development stages? Like, what would you recommend of parents?
Yeah, I recommend doing it as early as possible, right? My youngest patient right now, we started about 4 months old, right? Looking at elevated reverse T3 in this child. We only have one study, as we've already previously talked about, that we have only one study that looks at reverse T3 levels in infants. It was from 1975. Like I mentioned, we are desperately in need of more research in levels of reverse T3 in children with Down syndrome and children without Down syndrome, because what I see is that children with Down syndrome in infancy, very early, their reverse T3 levels stay elevated longer than they should. Into 6, 8, 9, 12 months old toddlers, right? They have elevated reverse T3. And as soon as I can lower that as possible, I do. And so the study in 1975 said that reverse T3 in infants is normal, and it is. In utero, infants have elevated reverse T3 to protect their little tiny bodies from the large amount of T3 that the mother's body is producing for her own physiology. But at 9 to 11 days, that reverse T3 should be lowered to the range of a normal adult reverse T3 level. And it's not. That's not happening in Down syndrome.
That's incredible. So as for treatment, what do you recommend? Micronized T3? Are we doing glandulars? You want to kind of talk about that?
Yeah. When I see an elevated reverse T3, I address underlying causes, I do, but they need that reverse T3 lowered like yesterday, right? If they're coming to me, they may have had a reverse T3 elevated for months. And so I reach for T3 only medication, liothyronine and cytomel. And I'll tell you, when I first started doing this with kids, no one's doing this with kids no one's using T3 only medication. And I'm not going to lie, it worried me. I mean, this is strong, potent stuff. You don't mess around with T3 hormone. But I was, everything I looked at, I got the labs in front of me, the kid, everything was saying that this child needs T3 only medication. And so when I first started using it on children, we used it topically, right? Because I was like, oh, let's try transdermal T3. And I had a compounding pharmacy make it up for me, and it didn't work. And then I had another mom come to me, and she was really proactive. She wanted to use it. So we crushed up a pill. She put it in a syringe of breast milk, and she gave the child a little squirt. Every diaper change, she gave this child a little dose of that teeny tiny 5 micrograms of T3, and the child's blossomed. And so now when I see an elevated reverse T3, and I put everything together. I'm not just treating an elevated reverse T3. I'm looking at symptoms, and I reach for liothyronine. And it can very quickly lower that reverse T3, sometimes in as quickly as a month.
Wow.
Quickly as a month. So I use that when there's an elevated reverse T3, and then I also use natural desiccated thyroid hormone if other lab values indicate that that's warranted as well.
Mm-hmm. And then from a symptomology standpoint, what are parents seeing or noticing with these children after we get the labs normalized and so forth? What sort of symptoms and behavioral type things do you see?
This is the really cool part, right? So when I started doing this work, I had no idea that this was even possible, right? As a naturopathic physician, my child, has mosaic Down syndrome, and we're working on gut and immune system and really good food and genetic overexpression and oxidative stress. So I thought, I'll help some other kids with this. And then the thyroid picture started coming forward, right? And I was like, oh my gosh, all these kids they're experiencing hypothyroidism. And so I had no idea that this was even possible. So when I started using thyroid hormone, what I saw going away immediately that really just surprised me, their reflux. Acid reflux in an infant is also dangerous, right? It can cause heart, lung, ear infections, right, caused by acid reflux in infants, right? You get a kiddo with chronic ear infections, sinus infections, nasal congestion, increased size of tonsils and adenoids. All that can be caused because of acid reflux. And why do we have acid reflux in a child who is hypothyroid? Because things are shut down in the body, and gut motility is shut down. So we get acid reflux and constipation. I kid you not, gone in a day.
Wow.
Acid reflux gone in a day. That 4-month-old that I spoke about had his lungs collapse, heart stopped. He was on ECMO in critical care, right, because his acid reflux was so severe. He was on an NJ tube, finally convinced the doctors to use liothyronine, and he was heading home yesterday.
Wow.
His reflux was greatly reduced, and he did not need the surgical procedures that the doctors had recommended for his reflux, surgical procedures.
Mm-hmm. That's insane.
Yeah. So reflux and constipation is one of the biggest, like, oh my gosh, right away, right? We see immediate effects from that. And then I've got so many stories. I've got one kiddo who was 2 and not walking yet, just kind of starting, but really low muscle tone. And, and so we started him on proper thyroid hormone, and I've got the video. Mom's got a blog of him before. 3 weeks later, she's got a video of him standing up and walking across the room.
Wow.
So increased muscle tone, gross motor development, and many other areas that still to this day shock me.
That's incredible. So I think I know the answer, but what are pediatricians like? How, I know in your area you have really good, I think Paul Thomas is a really good integrative pediatrician, but most pediatricians are probably not on board with this, are they?
They're not. Yeah, this is the hardest part of my job. I wish I could just treat patients, right? And I think about this often, how the fight is exhausting, right? I have parents who say, can you speak to my pediatrician and get them on board? And I just don't have enough time in the day to educate individually, right, pediatricians. And I can help children, from where I'm at, but they're often not on board. And some parents get outright what's the word I'm looking for? It's patronized and sort of yelled at by their doctors, right? Endocrinologists, for sure. What are you doing to your child? You're gonna, but sitting right in front of them, there's this child that's doing remarkably better. So it's frustrating. There are doctors who are on board, and they're worth their weight in gold when they're supportive and doing labs that I recommend. And but that's not always the case.
Right. That's incredible. We'll keep up the good fight. And it takes a while for new paradigms to be adopted and accepted, as we know in medicine. So now you mentioned labs a couple of times. I just want to give folks real specifics, labs that you recommend. I mean, can we get this from Quest and LabCorp? Do we need boutique labs? Like, what do you recommend for parents?
Yeah, I don't know if parents are aware that if you have a doctor who is unwilling to do the recommended labs that either I recommend, Stop the Thyroid recommends, thyroidchange.org recommends, right? All the doctors who are out there working to create change in thyroid care in our country, if your doctor is unwilling to do that, you can order your own labs online. I don't know if people are aware of that. There are several websites out there. I don't know if we can mention the websites, but
sure.
Yeah, directlabs.com is one that I often send parents to. You can order a thyroid panel complete. You have to add on antibodies to that. I ordered my son's labs this way because of deductibles, and we can't get labs covered in that. For a couple $100, I can get a thyroid panel, a CBC, a zinc, and a copper on my son, and so you can order labs yourself. But oftentimes, if doctors are willing to order them, then insurance will cover it.
Mm-hmm. But even then, you mentioned something, and I have a personal story with this, with insurance. You think that if you have insurance that you should run your labs through insurance, but it's often cheaper, particularly if your deductible is high, to just pay cash outright with direct labs, or there's different co-ops and stuff like that. That's one in Florida. I can't remember the name right now that I've used before, but you get this expanded panel with CBC, diff, liver enzymes, lipids, expanded thyroid, and all that for like $200.
Yeah.
And so whereas, I got this bill from my insurance, and for some reason they didn't run my insurance, so I got a bill from LabCorp, and it was like $2,500. And
I was going to say $1,200. Yeah, we've gotten them too. Yeah.
Are you out of your mind? I'm not. Why would I pay? It's just insane how inflated it is and how much they charge our insurance companies. So just be aware of that. And it's oftentimes, like we said, cheaper to just pay cash. So great information. So let's kind of transition now to the genetic overexpression. Any genetic tests that folks should be aware of, before pregnancy and so forth, that they should kind of have tested to kind of know where they stand?
Yeah, I feel that it's important for every parent of a child with Down syndrome. Well, it's important for a lot of us for other reasons too, but to know your MTHFR status, right? And as we are, the conversation is growing. We know that MTHFR is only one of many SNPs that are involved in methylation, right? It is the one that's most often discussed, and it's most often researched, and there is, a connection between MTHFR SNPs and having a child with birth defects. So knowing your MTHFR status, I think in terms of genetic testing, can be really helpful, and that is a lab that can be done through Quest Diagnostics and LabCorp. Insurance will sometimes cover it, but 23andMe, for $100, you can look at a lot more than MTHFR, right? MTRR, right? MTR and MTRR, they're related to methylation of B12. That's also related to having a child with Down syndrome and birth defects. So there are others.
Mm-hmm. So what have you found to be the most effective? I know, when it comes to calcium folate and 5-MTHF and adenosylcobalamin versus methylcobalamin, we've had Norm Schwartz on the show, which is a colleague of yours and is really prolific in the autism ADHD community. But what would you suggest in terms of generalizations for parents that are trying to figure all this stuff out in terms of guiding them to the right, supplemental support when it comes to folate and B12?
Yeah, it's tricky. It's individual for sure. But in children with Down syndrome, right, I'm speaking generally, but it's also very individual. There's a tendency towards undermethylation, right, because the methylation cycle is being pulled, right, it's being stressed, right, being pulled by CBS is on chromosome 21. It's being pulled by DNMT3L is a gene that's on chromosome 21 that they sort of use up these methylation intermediates within that cycle. So the way I simplify it, it's not always this simple, but for your viewers out there, is I feed the methylation cycle, right? We want to put into this glass that has a hole in it, right? the hole in the bucket is the analogy that's often used, and it's being drained. And so we want to keep filling that hole in the bucket as best as we can in a balanced way, of course, with methylfolate. I reach for methyl B12, right? Sometimes that doesn't always work. Sometimes kids get a little bit too much energy from it, too anxious or hyper. And then I'll back off and we'll use either adenosine or hydroxy B12. Another way to sort of feed the methylation cycle is methionine. It's a little bit controversial. I'm in discussion with researchers, some other clinicians on whether methionine is helpful, useful, warranted, and not harmful, right, in children with Down syndrome. So feeding that methylation cycle and reducing the draw on it by, like you first mentioned, reducing toxins in the environment and supporting methylation as much as possible.
Fantastic. And I like how I was visualizing like this sink, and then it's being drained. And below we have, the oxidative stress, free radical stressors, glutathione insufficiency, and so forth, pulling on the methylation cycle. So I think a lot of folks tend to just be so fixated on methylation and CME, which is really fantastic and great and so forth. But we need to look at the source of what's kind of tugging on that. And you talk about things like avoiding Tylenol and various stressors. So do you want to dive into this oxidative stress detox kind of loop here that's involved?
Yeah, I've simplified oxidative stress as best as I can. It's a complicated process that goes way back to basic chemistry and electrons. I'll skip that part of it. Oxidative stress is something that we all experience. It ages us, right? And our children with Down syndrome experience higher levels of it. And the reason for that is complicated, but it has to do with the genetic overexpression, right? Glutathione, as many of you viewers know, is one of our most important antioxidant enzymes within every cell of our body, but it works together with SOD, right? They're a team, right? They take free radicals and they convert them to water. SOD is on chromosome 21, right? And SOD1, I should say. And so what SOD does, it takes the free radicals and converts it to hydrogen peroxide. Glutathione then converts that hydrogen peroxide to water. The problem is we have too much SOD and not enough glutathione to keep up, sort of like a fire brigade of water buckets. And that glutathione is just like, wait, this is too much hydrogen peroxide. And unfortunately, what the body does with that excess hydrogen peroxide, literally excess hydrogen peroxide in the bodies of these kids on a cellular level, the body converts that hydrogen peroxide to hydroxyl free radicals, which are unfortunately one of our most damaging free radicals in the body. So what do we do about this, right? So that's the basic. So what do we do about it? We prevent free radicals. It's a three-step process. Prevent free radicals in the first place, so we don't even need this SOD glutathione system that's imbalanced, right? And that's healthy diet, colorful fruits and vegetables, vitamin E and vitamin C. Vitamin E, super, super excited last year. 2 studies came out last year testing actual children with Down syndrome, not mice, not cells in a petri dish, using vitamin E, and showed in these studies that they lowered markers for oxidative stress, 8-hydroxydeguanosine being one of them, lipid peroxidase being another one of them, and they positively lowered those markers of oxidative stress. So guess what? All my kids, vitamin E, right? So we prevent free radicals as much as we can in the first place, and then support glutathione levels, right? And no Tylenol for sure, right? I mean, I'm so glad to see that discussion is coming out more, that people are aware now that that Tylenol isn't necessarily the benign, take as often as you want drug that it, was promoted to be in the 80s. It positively lowers glutathione levels, right? And we treasure every speck of glutathione we can in our kids with Down syndrome, and we don't want to lower them anymore. So avoiding Tylenol for sure. And then because the methylation cycle feeds into the transsulfuration pathway that makes glutathione, supporting methylation naturally supports glutathione production as well. And
beautifully said.
Yeah, thank you. Yeah, thanks.
You said that a few times, I'm sure, to parents. And
yeah, I've said all this.
That's awesome. Fantastic. So let's kind of tackle glutathione a little bit. There's many schools of thought, given the precursors, glutamine, NAC, glycine, and so forth. There's direct glutathione, liposomal. What have you found to be most effective in your practice?
Yeah, there are studies that show that, some new studies showing that oral glutathione supplementation can raise cellular levels of glutathione. Again, really exciting. But glutathione doesn't taste very good. It's a huge obstacle with kids is taste. Gosh, it's really, I tell you, this is the biggest conversation we have with parents is how to get these kids to take this stuff. So that's tricky, right? Actually taking oral glutathione. And I don't know if that's really what I want to do, just give the end product, because then we get even more imbalance of things that are building up the pathway. We want to support the pathway, right? We want to support where the imbalance really lies, right? I do choose oral glutathione in some children, but not ignoring the pathway to make it. So oral glutathione is possible. And then there was a study done, Dr. Jill James, amazing work Dr. Jill James is doing for our children. I believe it was in about 2001, homocysteine metabolism in children with Down syndrome. It's one of the best. If you want to study this process or learn this with children with Down syndrome, that's my go-to. And she used cells, white blood cells of children with Down syndrome, bathed them in various nutrients, intermediates of the methylation cycle, to see which intermediate raised glutathione the most, right? Really great study, table 3 in the study. Folinic acid, methyl B12, methionine did show that glutathione was increased on a cellular level, but again, there's still some debate about methionine because it oxidizes easily. But folinic acid and methyl B12 were two of the biggest that helped raise glutathione levels. So I use those.
Fantastic. Yeah, and if people just Google Jill James and go to Google Image, she has these great diagrams, which you've been talking about, in the transsulfuration cycle and the methionine cycle and so forth. So I think that's really nice. And that really helped me. I remember when Jeff Bland interviewed Jill James in like 2005 or 2006, and that's been stuck in my mind. And I meet a lot of different practitioners, Dr. Peirson, and a lot of folks kind of aren't aware of that. We kind of think methylation's in its own little bubble and box, and it's isolated from detoxification and glutathione, but they're so linked. And so I love how you really reinforce throughout this call that we have to support both, which is really important. And there's something else that you really like to support, and that's cell membranes and phospholipids. So kind of share with us why that's important and the best way to improve our cell membrane health.
Yeah, that's actually the third step of oxidative stress, right? Should that oxidative stress happen, regardless of all the prevention we do, where that damage occurs, oxidative stress, is DNA itself and cell membranes. Cell membranes are really cool. Dr. Bruce Lipton, he's a cell biologist, and he does some really cool lectures and good books and discusses cell membranes, in that they are what are controlling our cells, right? It's not the DNA, right? DNA is just a blueprint. DNA doesn't work. It's just sitting there waiting for things to happen. And where the real conduction of the processes of the cells occurs is dictated by what's happening on the cell membrane, right? How that cell is interacting in its environment. And if that cell membrane is not healthy, it's not going to function well, and that cell isn't going to function well. And so one of my favorite concepts, right, even all through undergrad and med school, of cell biology is the cell membrane itself. It's that phospholipid bilayer. And within this core of this cell membrane, right, the cell membrane is analogous to the skin of our body. Within the core of that are fats, right? Easily oxidized fats, right? They're the type of fats that are that you would keep in your refrigerator in a dark bottle, right? Because they're really susceptible to oxidative stress and damage. And so, but the body's really cool, right? Should damage occur, our body doesn't just fall prey to this damage and it become sort of permanently damaged. The body can repair itself. There are mechanisms for the body to repair itself, not only on the cell membrane, but on DNA itself. And so we support those processes of repair. And so phospholipid bilayer, we can eat phospholipids, provide our body with those building blocks for that repair to occur. And those are phospholipids that you can get as phosphatidylcholine, lecithin, right? One of the best sources, egg yolks, really high in phospholipids. And I like to support all phospholipid levels, not just phosphatidylcholine, right? Because if you really study the cell membrane, it is rich in phosphatidylcholine, but it's also rich in phosphatidylinositol, phosphatidylserine, phosphatidylethanolamine, right? And so I'm more of a fan of using lecithin, preferably from sunflower, to support the cell membranes as best as we can. Yeah. Cell membranes, really important. They're really dynamic. There's a lot going on cell membranes. For
Yeah,
sure.
I'm sure we could. That's amazing. I haven't read Bruce Lipton's new book. I've read Biology of Belief back a long way ago, but I know his new book is all about cell membranes. Is that right?
Say that again? His new book?
His new book really focuses on the cell membrane.
Yeah, I don't know. Yeah, maybe it does, but the Biology of Belief, yeah, that's the one I read a while back too.
Yeah,
sure.
That's a good one. Okay, so now do you take like standard lecithin, or are we talking about that purified material? I think Zymogen has one, Patricia Kane has one. It's that liquid. Is that what you use, or?
Yeah, I tend to reach for the sunflower lecithin granules. I go to lecithin. I'm not sure what the products you guys have, but what I've seen is a lot of them are from soy. A lot of my families avoid soy at every turn, but those are great products for sure. And there's technically no allergen, right? There's no protein in there. When somebody's allergic to soy, there's no actual allergen in there. But many of my parents avoid soy when they can.
Sure.
So I tend to reach for the granules are easier to give, right? The granules, you can mix them with, coconut yogurt. You can sprinkle them in soup. You can sprinkle them on, veggies, mix them in smoothies. And so I just find the granules, again, I have to balance how easy it is to give the kid and which is the best one. And so I tend to reach for the granules. Yeah.
That's awesome. Now, can we find these at health food stores? I haven't looked for the specific sunflower lecithin granules.
Yeah, I tend to direct parents to discount websites when possible, right? I make recommendations from various sources of supplements, but the sunflower granules you can get online on some of the discount supplement websites. Yeah.
Awesome. Great info. Cool. So we have two final questions, but I'd like to ask every guest, is there anything that you would like to share that you didn't get to cover before we dive into our transition here?
No, we covered a lot of the bases for sure. I guess the big message that I want to give is the organization that I'm the executive director of. It's a nonprofit. We're called Down Syndrome Options. Our website is downsyndromeoptions.org, and our message is to parents of children with Down syndrome, parents who are struggling with the decision of termination of a child with Down syndrome. This goes beyond our discussions, but it's a really big another topic that I talk about. It's an extremely personal decision, but I want them to know that there are options out there for their children. Children with Down syndrome historically have not received the medical care, the addressing of the genetic overexpression that can greatly impact and change the course of their life. And the children that I work with today, I know that their future is a lot different than the reality of adults with Down syndrome today. And so I don't want parents who get a prenatal diagnosis to picture that adult with Down syndrome who maybe never went to school, maybe never got proper nutrition, certainly didn't get proper thyroid care, that's not the future for their child. Still an extremely personal decision, but I want them to know that there are options out there to make their child, that we can make their child as healthy as possible as early as pregnancy in utero. So.
Beautifully said. So that domain, and then we'll talk about your website too right now. It's a good time.
Yeah. So I have a couple of websites. I recently transitioned my practice. And so my practice is now the Peirson Center for Children because I'm helping more than just children with Down syndrome. A lot of what we talked about today translates to children with autism as well, right? Thyroid function, right? And children with autism, thyroid function of the mother in utero. So I'm helping more than just children with Down syndrome today. And so my practice is pearsonCenter.com. That's the website. My previous website was downsyndrometreatment.net. And so I'm slowly transitioning everything from downsyndrometreatment.net that's related to my practice over to pearsoncenter.com. And downsyndrometreatment.net I'm going to leave as a source of information for parents, articles, research library, how to find a practitioner right? How to find a practitioner who's doing this, who's looking beyond what conventional medicine has to offer. And so I'm really excited. That's my newest thing, is find a practitioner, because I don't want to be the only one doing this.
Sure. Yeah, you'd be too busy. Fantastic. So we'll put those links in the links to options, that URL at highintensityhealth.com/Dr. Peirson, as well as the show notes. So great information here, Dr. Peirson, but two final questions that we ask every guest on the show. And the first one would be, if there was just one herb, nutrient, or botanical that you frequently recommend and can't live without, what would that be and why?
Well, it doesn't necessarily fall in these categories, but it's a glandular. I would say thyroid hormone, right? I have parents who reach out to me globally, and some of them can't always get everything that I recommend. If I were to pick one thing, thyroid hormone. Right? Even if you can't address oxidative stress, if you can't address methylation, you can't get vitamin E, what have you, if you can fix hypothyroidism, you're going to get better digestion, better absorption of nutrients, better overall growth and development in the child. Thyroid hormone.
I love that. No one's ever said that before, but it makes a lot of sense. From what I understand, every single cell in the body has a receptor for T3. Is that right?
Totally. Yeah, absolutely. Every single cell. Yeah.
That's amazing. Great stuff. So the final question, Dr. Peirson, if you were to bump shoulders with the current president, Barack Obama, or a future president, and they turned to you and said, Dr. Peirson, as a healthcare practitioner, what lifestyle or health tip would you want me to share with Americans in the world? What would that be and why?
Yeah. I hate to keep harping on this one, but get your thyroid checked. Get your thyroid checked, right? So many neurological conditions. That's what I would tell President Obama, right? As we age, our thyroid hormone function declines, right? And so if we can optimize thyroid function all throughout life, right? Definitely in infancy, but all throughout life, it's linked to Alzheimer's, thyroid function. Thyroid function is, linked to a lot of neurodegenerative conditions. And so get your thyroid checked. That would be my advice. Yeah.
Just TSH, right?
No.
I'm just kidding. I was just kidding. That's awesome. Great information. I really enjoy talking with you about this information and where you're going with this and the amount of people that you're able to help. So, Dr. Peirson, keep up the great work, and thanks for tuning in with us.
Thank you so much, Mike, for this opportunity. I appreciate it.
My pleasure.